Good morning, everyone. Thank you for joining us on behalf of the Florida Department of Health in Volusia County. Welcome to the 2021 Path for Hope Virtual Summit. This session is being recorded. My name is Lynn Kennedy, and I'll be your facilitator for this session. You have joined the session titled Going from Jaded and Junkie to Compassion and Community, a Paramedic Nurse's Journey from Apathy to Advocacy for Harm Reduction. Just want to make sure you're in the right place. You can submit questions through the chat box throughout the presentation. You can also use the raise hand feature. If you move your cursor toward the bottom of the page, you'll see an option to raise hand. If I see a hand raised, then I will be able to ask our IT support to unmute you. So we can do that throughout. Our presenter will be asking for questions throughout, so we'll take a moment here and there to do that. I want to thank the Path for Hope Summit Planning Committee partners, Advent Health, Community Coalition Alliance, One Voice for Volusia, SMA Healthcare, and Volusia Recovery Alliance. It's my pleasure to introduce to you Mark Rowley, who will tell you a little about himself.
Good morning, and thank you all for taking time out of your day to join. And thank you, Lynn, and Volusia County, Department of Health. So my name is Mark Rowley. I am a paramedic firefighter with Jacksonville Fire Rescue. I'm currently one of the assistant chiefs, primarily over the data, the 911 systems, and oversee several opioid projects, overdose prevention projects for Duval County. I'm also a nurse and recently just stopped working at a drug treatment center. Locally, I worked on the weekends and also worked in a very busy ER. I just stopped working as a nurse a few months ago so that I could pursue a psychiatric mental health nurse practitioner. So I'm almost halfway finished there at Jacksonville University. So I've got about 29 years working in pre-hospital, started right out of high school. So I'm going on my 29th year today, or pretty much this month of my birthday. So thank you. So I want to reiterate that as I go through this presentation, please chime in, speak up, raise your hand, throw in a question. I can't see them right now, but Lynn will be watching, and I welcome any interruption, interjection. So thank you all. So as I mentioned, I've been doing this 29 years. So I want to take a look at, want y'all to see my paramedic book. So I got it right here in front of me on the screen here, but this is 1995. So I started in 1991 EMT school, and 95 decided to become a paramedic. And so as you'll see here, I'm going to highlight something that they taught me about drug addiction. And there's the word junkies, drug abuse. We had just about 3 or 4 pages on drug abuse. And they use the word junkie and addict. Those are the 2 predominant words. So, and here's another one here, addict. So also want to see if I can highlight the how I was taught by good intention by my educators, preceptors, and instructors what I should expect from an addict. And I can tell you that what I was taught, what most paramedics and firefighters were taught, that it was unsafe for us. Our safety first. And going to an addict is dangerous. And I'm not necessarily saying that it's not, but what they literally told us is that when we give Narcan, addicts will become aggressive and combative. Those were the 2 words. An addict will become aggressive and combative. Nowhere was I ever taught that when I give somebody Narcan, I put them in pain. Nowhere was I ever taught that when I reverse somebody who's opioid dependent and I reverse their overdose with Narcan, I bring the receptors alive and they are hurting, their stomach's hurting, their nerves are hurting, their mind is hurting. No. We were done a disservice. Good intention. But I just want you to understand how I was taught and how predominantly all paramedics and firefighters were taught back in the 90s. And again, if you have any comments or anything, just feel free to throw them in. I can't see, so I welcome that interjection. My intention is to be very raw with y'all and very authentic. So some of you all may have seen the movie Waking Up, They're Bringing Out the Dead. I'm going to show you a little clip of Narcan if you haven't seen it, because this is truly what we did.
Okay, what happened?
Please tell me he's gonna be all right.
No, he dead.
Bugging, we just signed our first record deal.
Look, he dead, son. Ain't nothing we can do about it. Come on, Frank, that's it.
What do you mean he's dead?
He's not dead. It's a heroin overdose. Let's break out the Narcan.
He's dead unless you folks want to stop bullshitting me and tell it straight. Then the good Lord willing will try and bring him back.
Broke up with this old lady.
We didn't break up. We were just seeing other
she
people.
broke his heart.
Shut up, asshole.
Tell me
Nobody
to shut up
asked
like
you.
you
I
want Jules. I told you.
dick. I will. Shut up.
I'm still waiting and this young man here is still dead.
You want to leave him in a body bag too?
You end up like him.
Shut up.
Dick. Shut up.
He's been snorting that red death stuff. It's been going on for like 4 days now.
Rebuke the spirit of drugs in the name of Jesus. What's his name?
I be banging.
What you mean I be banging?
I be banging.
What the hell kind of name is I be banging?
I don't know his real name.
Frederick Smith.
Okay, Freddie.
It's Frederick.
Okay, I be banging. We're gonna bring you back from the dead. Now, I want everybody here to grab the hand of the person next to you. Come on now, we ain't got much time. And look up towards the heavens. Dear Lord, here I am again, asking one more chance for a sinner. Please, Lord, bring back I be banging, Lord. You have the power, Jesus. You have the might. You have the super light to spare this worthless man. Rise up,
Frederick.
I be banging.
Oh, my
and
God.
start your life anew, Lord. Oh, thank you, Lord.
What happened?
You fucking died, you stupid bastard. I warned you.
Damn, you guys are good.
Not us. The first step is love. The second is mercy.
So I'm curious, has anybody here either given Narcan? So I don't know if we have providers on this call right now, or has anyone actually received Narcan? And when I say received Narcan, has someone like me in ignorance slammed it in you and you woke up, but you woke up vomiting. You woke up sick. So, and
feel free to enter into the chat or to raise your hand.
yeah. Also curious, has anybody ever put down an NG tube or received an NG tube? So I could tell you we did that very often. So in meeting a lot of people just over the past few years, really trying to learn more about harm reduction and how I can truly meet people where they're at and get involved and better understand. One of the first things that I really had to reconcile was that largely I was not liked by somebody in active or at-risk drug use. I was the last person they wanted to see because I was taking away their high. I was putting them in pain. I would shove a tube down their throat. I would strap them down at the ER and push charcoal for them to then vomit or basically have diarrhea. I was the person, like many of us, that were treating people inhumanely, in my opinion. When I look back at almost 3 decades of working the ER and ambulance, I enacted my jaded, I don't want to say venge, but I always thought that, hey, this tube, when I put it down their throat, this will teach them. This will make them stop. How stupid of me. So I didn't understand addiction. And this was me just back in those good old naive days. So just on the street, having a good time. And I can tell you numerous times that I truly laughed at slamming Narcan 2 milligrams in somebody's IV, like you saw in that movie, knowing that they were going to wake up vomiting and maybe even have a withdrawal seizure. And I'm not proud of that. So here's a typical response. We are seeing a lot more overdoses on the roadway. So this is not Duval Jacksonville Rescue. It's from St. Louis.
Doors locked. Doors locked.
Get him out.
Okay.
Got him.
Yep.
Does anyone know him?
No, I was at the light and I just seen the vehicle parked.
It's on. Positive. It's on.
Hey, what's going on, man? Take a breath. Take a big breath.
There we go.
I'll be right back. I'm gonna get some. There you go.
Gotcha.
Hey, take a breath. Big breath. You all right, man? What's your name? What's your name? What's your name? Hey, hold up, stay right here. Just relax here, okay? We're helping you out, okay? We're at the fire department, okay? We just gave you some medicine. If you're overdosed, okay? Take a big breath. There you go.
Mhm. So if you're able, and Lynn, I'll ask just as you're able to maybe type in your profession or typically what you're representing, why you're here today, and what, I guess, in what role, so I can, I guess, better steer this. And my apologies, it's a little late in the game, but so I want you all to just understand that these responses we go to routinely 400 to 500 a month, several times a day. Many of our paramedics, myself included when I was out there, would see the same patient daily, several times a day. So one of the inherent work-related hazards for any healthcare provider, and my guess is you included, is
Mark?
compassion fatigue.
Mark, we have some answers in the chat. Would you like that?
Yes, ma'am.
Okay. Addiction treatment and person in long-term recovery. DOH Duval, OD2A epidemiologist.
Yeah.
Oops, they're coming in fast.
I know you're hiring for those. You got 2 epidemiologist positions.
Florida Department of Health nurse and RN. Ally for Recovery, serving in a faith-based recovery. A drug prevention coalition. I am here for vets, a resource for veterans. And let's see, OD2A, opioid prevention, DOH Clay, prevention educator and a community coalition, and a paramedic for 38 years, now working with Florida Department of Health and OD2A. So that gives you an idea of who's your audience here.
Yeah, thank you very much. That's an incredible breadth of experience and knowledge there. And my judgment is a lot of passion. So, and again, for any of you, feel free to chime in, especially you nurses and that 38-year paramedic, because my guess is I'm singing a story that you've probably lived many times. So, given the repeat exposure to the same thing, that develops compassion fatigue. It also, in many ways, can predispose healthcare workers to trauma, which could then become, whether or not it becomes PTSD or just PTS, but absolutely work-related hazards. And there's no getting around that. I think that's part of the sacrifice that we as healthcare providers and you all hopefully recognize when you're in service to people. So, but that stigma, I was unaware of it because it was largely celebrated. It was celebrated by my fellow firefighters at the station. It was celebrated by my fellow nurses at the ER. And I was angry. And I believe I had a right to be angry. Seeing people that I judge were flippantly not regarding what they had or their life. Again, I didn't understand addiction. So in my stigma, I still ignorantly believe that this was all about choice. And I recall I was on our peer support team and went to, it was a double fatality for overdose. And it was a mom with 2 kids and a boyfriend. And the mom and the boyfriend died. And there were 2 kids, infants, at the house, obviously unattended. And so as part of the peer support team, I went out and just checked on the firefighters at the station. And just getting a roundtable discussion, one of the firefighters was very withdrawn, and later, just was able to provide some time with that firefighter in private. And that firefighter shared with me that he could not understand why parents would, do a drug knowing that it could die, and leave their children like that. And we went a little bit further with his question, which turned into judgments, which turned into projection. Because this firefighter and his wife were trying to get pregnant for 2 years and could not. And he was so angry that here's a couple that has children and he doesn't. So these things really played out unconsciously, and I believe they played out unconsciously in all of us. And that was, I remember that because it was a trigger point for me to realize, wow, we really got to work on compassion fatigue and understanding how I may project onto a patient or their situation. So there's a story of 2017, I believe here, a Massachusetts firefighter that posted on Facebook derogatory remarks about persons in drug use, saying that Narcan is the worst drug ever created. Let the bags die. So I use a curse word. And I, for one, get no extra money for giving Narcan, and these losers are out of the hospital and using again in hours. You use, you should lose. And the reason I put this up there is, again, to try to make sure, unfortunately, if you're not already aware, there's a lot of stigma out there and compassion fatigue. And unfortunately, not only does that compassion fatigue come out in sideways comments, but it also comes out in aggression, oftentimes toward the patient or their family, or the whole system. I can tell you that when I'm going to talk about our nasal Narcan, and I run a nasal Narcan program, and I have been beat up over it, just like this firefighter posted those comments.
Mark, we have another comment that says, awesome story of self-education and compassion for your fellow man. Welcome to Healing and Helping. We need you.
Yes, thank you. So you're fixing to probably see an ugly face. So, because this is hard. In 2011, I was on the street in a rescue unit, and I was dispatched to a seizure call, a seizure. And the seizure was in my neighborhood, like literally a mile from my house. And on the way, just as I started to turn off that street onto the main road, a motor vehicle accident got dispatched out a half mile down the road. So we're all ALS. The fire engines got paramedics and equipment. They're rolling behind us. So I said, you know what? Let's just divide and conquer. We're going to roll to the motor vehicle accident, tell the engine to go to the seizure, and we'll send another rescue or ambulance to the seizure. That way we can get, paramedics on scene quickest. So very common in what we do out there in the field. Well, I go to the motor vehicle accident. We transport a patient to the local hospital, and another rescue goes to the seizure call. And while I'm unloading the patient, basically cleaning up the stretcher, getting the ambulance ready, over the radio, the rescue unit that was at the seizure calls and says, rescue 21 Rowley. And normally they don't call your name on the radio. And I know our paramedic knows that. We usually use unit numbers, apparatus designations. So I got on the radio and I said, Rowley here. And they said, we're going to be there in 5 minutes at the hospital. We need your help. Make sure you're out back. And typically when a rescue unit calls for assistance unloading, it's usually because the patient is heavy. They need assistance in lifting, or it's a critical patient, maybe a lot of equipment or support that is needed to safely unload and transfer the patient. So I go out and I tell my partner who's inside to write a report, and I'm going to go out there and just wait on the other rescue. A few minutes later, they call again and say, hey, Rowley, are you there? And I'm like, sure. So the rescue backs up. And as soon as they backed up, the doors open and I jumped inside. And I'm looking around. I see the patient on the stretcher who looks very bad. Got a lot of IVs, they're bagging. Got two large bores IVs, all the cables on them, covered in medical equipment, basically. And I asked the lieutenant, I said, okay, what do you need? And he's looking at me and he kept pointing, he goes, look. And I'm looking down at the patient, looking around. And I said, what do you need help with? And he goes, look. And I looked down at the patient. I'm like, what are you talking about? And I literally said, what's going on? And he lifted the non-rebreather mask up basically off the patient's face. And he said, look. And on the stretcher was this man. So this is my mentee. This is his picture you're seeing. He lived with me. He left the house that morning. He overdosed. I did not know that this young man that was living in my house was doing drugs. And he lived with me off and on for years. Him, his wife, through his baby, post his divorce. And here he was at 21, 22 years of age, lying on a stretcher, pale, and was in the ICU for 7 days. He survived. He has brain damage. So it was the closest that I felt like a failure. Going, what did I do wrong? How did I not see this? And I'm not a parent. So I can only imagine what parents or family members go through when they have somebody in their family that struggles with at-risk substance use, because I was completely naive. I thought this was my wake-up call.
Message of support, Mark, for your sharing your emotions. It says, we get it, Mark. Just want you to know.
Thank you. So again, this presentation is about me going from, jaded and junkie to some compassion. So what I realized at that moment, the takeaway that I got at that moment of seeing this young man who's my mentee, like I'm his father figure very much in his life. And the takeaway for me was, I didn't know what to do. It was the first time that I truly felt helpless. And that may sound crazy, but by then I was a 20-something-year paramedic. I've been in the Coast Guard for 6 years as a corpsman. I have done a lot of stuff. And I quite frankly had a great ego, and I could go on any scene and turn a lemon into lemonade. There wasn't any call that I went on that I wasn't able to shine. I'm not saying every patient got saved, but I felt extremely confident, maybe overconfident, that I was, bravado paramedic firefighter and can do anything. And this was the first call where I said, I don't have the skill set. I don't have the knowledge base. Why? Because they don't teach paramedics and EMTs that. They didn't teach me about public health. They didn't teach me about disease and disease prevention. We got a little bit of injury prevention, a little bit of trauma prevention, a little bit of fire prevention, but something about mental health, wellness? No, I don't even think there's a chapter on that. And that's why I decided to go to nursing school. And talking to some nurses and some friends, I said, what I understand is nursing is about the curative model, where a lot of medical and even paramedics are taught the curative model. We're taught to give something to cure or to turn something around. Nurses largely are about holistically caring for a patient. And so that is why I decided to go to nursing school kind of late in the game. And as this photo shows, I certainly love nursing school. This is actually something I drew.
We have a comment in the chat that says, persons struggling with drug addiction are very good at hiding it. Exclamation point.
Yes. Yes. Thank you. And I would have probably told you I agree, but until it hit home to me a little bit, I just don't ever really believe that. And so I went through nursing school. I took all those little things I learned on the cruise ships about making towel animals to heart. There's me in a cancer area, and one of the patients left to go get her her chemotherapy. And while she was gone, I made her some towel animals. And I share that because I try to have a lot of fun and humor. And the nurses, the preceptors, and the patient said it was one of the nicest things they've ever seen. Something so simple that could convey compassion and love and respect. And on the right is a fake photo. I didn't really wear that hat. I just wanted to make my professors nervous. So something I learned in nursing school is trying to look at how so many things impact the patient that I may be unaware of, and that the patient may not be able to tell me. Maybe their body's telling me, maybe their emotions are telling me, maybe the response to me is telling me, maybe their instability in job is telling me. But all these things, all these warning signs, these indications that I started to try to have a better appreciation of empathy for my patients. And so this is this is part of a report I did years ago. And I just wanted to show this little graphic I created to try to illustrate that so much I'm unaware of.
Mark, we have another message. Powerful stuff. Thank you so much for sharing. Your message fights stigma head on.
Good. Thank you. Thank you for that. And if anybody has any questions or add-ons, please add to it. Oh, yeah. So I became a nurse. And I thought that's good enough. I have this empathy and understanding. And ironically, I went to work in the ER, and still my stigma was there, being jaded, seeing the patients come in. The patients that came in 2 or 3 times, I would meet them at the door with the AMA going, "Are you going to stay this time?" And half the time they would sign it, and I would feel like, okay, well, fine. You're not going to waste our time. I'm not going to waste your time. Again, this was only a few years ago. So these 4 photos are 4 funerals I went to over the course of a year and a few months. And these 4 funerals, these are the 4 funerals I went to in a year and a few months. All 4 died from overdose. All 4 battled addiction. And as you can see, some of them are our own. My own firefighter brother, Travis Williams. So that's what I'm calling my tipping point. And that's when I decided I can do a lot more to get involved. I can take my experience of paramedic, my new knowledge as a nurse, my role in the city to speak up and give some voice. And this was also about the time that we had our highest overdose death rate, drug-related death rate in Duval County at 519. It was the tipping point for the city of Jacksonville as well. And this is a graph. I do the data and kind of reporting here. It's hard to tell. Right in the middle where it says naloxone given is about December 17. That first high peak on the left, right above the dispatcher's overdose, is October 2016. And you can see that we've still steadily gone up. So there were some low points. At the lowest point is when we started Project Save Lives, which we'll hear about after me here with Dr. Palm. So, but overall, I just want you to kind of see that over 50% of our overdose responses are opioid related, based on the fact that we're giving Narcan, there's a response. You can see that our Narcan, we're giving sometimes more Narcan or naloxone than they call, meaning we're giving more, we're repeating doses of Narcan to these patients because of the intensity of the drugs and the fentanyl and things that are out there. It's the potency. This is just recent. If I take a 12-month look back, this map is all our substance drug related calls in my county. So, and if you know Duval County, I would say find where you live, find where you work on the map, and can you see it? Can you even, is it covered by a bunch of green and blue dots? My guess is probably yes. So, and this is just to show that it's really endemic to our community. It's, and as you all know, it's endemic to the nation. These are opioid related, just the blue dots. And we do have some hot spots, and I do work with local agencies to try to steer some services to our areas where we believe they're highest need or highest at risk. To give you an idea, the corridor, the 103rd corridor has a bunch of hotels, and we have been working to get nasal Narcan in the security guards' hands at these hotels. And we've already had several life saves at those hotels by the security guards. And so this is how I use the data. And I'm trying to use, I basically said, what can I do? How can I use my influence, my privilege and my job here to really do something different? Because just working as a nurse at the ER is not cutting it. Being on the street as a paramedic wasn't cutting it. So these are other substance related, which could be alcohol. So, and again, just I guess the message here is that it's widespread. And something that we noticed just really in the past year, we've seen an increase in our overdoses on roadways. And I use this to try to address those persons who, like me, before my mentee, before I saw my mentee lying on the stretcher, I live in a nice Mandarin neighborhood. I could tell you that we don't have that problem here, not in my backyard. That was my approach. And clearly, for anybody that was like me, I would ask, do you drive the roadways? Do you drive anywhere in Duval County? Because if you do, you're at risk. This is a public health problem. And I know you know that, but sometimes I'm working against firefighters, paramedics who were taught like me, and I've got to really combat that mentality. Something that we've started seeing just over time, over the past 8 years, is our overdoses and deaths in the communities of color, the Black, African American, Latino, Latinx communities. They have doubled. And while they still account for a small percent, doubling is horribly bad. And conversely, the Caucasian white overdose patient is decreasing. So this has really helped me and our elected officials understand that this isn't a white problem, because I was told that in 2017, when I started going around and speaking, when I presented to city council, several city council members said, Mark, the only reason you're passionate and people are going to vote is because this is killing white people. But where were you in the 80s and 90s when cocaine was ravaging my community? And I got a lot of that pushback. And I would say rightfully so. And while I can't undo the wrongs, what I can say is that, as you know, opioids, addiction, at-risk substance use does not discriminate. And largely what we're seeing here is that in the communities of color, largely these persons do not identify as addicts at all. Stigma, culture. It's okay to take a bump of cocaine. It's okay to do recreational drugs. It's okay to smoke a little bit of weed. It's accepted. It's expected. It's cool. And what we're seeing, and I'm trying to convey, is that you don't have to be an addict. One time, that one time that you think you're doing a bump of cocaine, that one time you're doing your speedball, what if it has fentanyl? You're dead. Matter of fact, you're more at risk because you're opiate naive. And so we've really been trying to help really address that and work in our communities of color. Pretty much every month, working with somebody in our Northwest quadrant to try to make sure they're educated and try to find people that have rapport in their community to get this word out of the dangers. So I'm curious, has anybody ever gone on a mission trip? And whatever that means, if it's the church mission, if it's overseas, if it's a medical mission, maybe you went. I went to Haiti. My sister lived in Africa for 3 years. I went to Kentucky on a mission trip, a church mission trip in high school. So let me know if you've gone on a mission trip.
We have one response that has been to Kosovo.
Kosovo, wow. Okay, so I'm curious, what did you do to prepare? And I'm going to speak over it, but feel free to throw your comments in. The person went to Kosovo. I can tell you that when I went on my mission trips, I went with St. Vincent's, or Dollars of Charity back then, Ascension Healthcare, St. Vincent's Boniface Haiti Foundation, and that was a medical mission. And we prepped for months. And one of the things that we prepped was their culture. So I was given a book on Haitian Creole, and I had to learn some language. I had to learn how to communicate, how not to communicate, the do's and don'ts of the culture. I had to learn about their religion, and a lot of the mixed religion. When my sister went to Africa, she had to raise money. So she had to write letters of support and let people know that she's going away. She had to get prayer warriors behind her. Support back home, support abroad. She had to learn their culture, their laws. She had to dress like them. She immersed herself just like I immersed myself.
We have a few comments, Mark.
Please.
Yes, I begin by learning from people who live there. Another comment, I was immunized. And another comment, we learned about the culture, the needs that they were facing, and lots of fundraising, as well as what clothes were acceptable.
Yes, thank you for that, that feedback. And yeah, the immunizations, you had to protect yourself because you possibly, hopefully you're seeing the analogy here, you had to get immunizations because your body was naive to what the people that you were serving were already exposed to. They didn't need the immunization because they were exposed. And the reason I bring this up is this was what I used to question myself about how do I serve people with at-risk substance use? What if this is my mission? My mission in my community, my mission in my backyard? Well, I must learn their culture. I must learn their language. I must learn how not to offend them. I must learn what they value. Maybe I have to raise money. Maybe I need to let people know what I'm doing so I can have some accountability and some safety. And I frame it this way because I really don't believe that that a lot of either healthcare providers and people in my position really take it and that they don't take that approach. And to this extent, even when we develop Project Save Lives for the first 2 months, and Dr. Palm may tell you, we're sitting here planning a program for people in addiction, and there wasn't one person in active addiction at the table. And I literally, it dawned on me, and I'm like, stop, why don't we have somebody here? Because how do we know this is going to work? We need people in active addiction to tell us, to help us understand better. Yes, we had people in recovery and many years of recovery, but we all agreed we need to get people that are still in active addiction here. And it was a game changer for us because they were able to be blunt and say, no, that's going to be offensive. Don't do that, or that's not going to work. And to me, that's part of that mission. And so I just want to encourage you to consider is that mission mindset, getting ready, preparing yourself, raising money, raising your awareness, raising your protection. That may be a way to help you serve going forward. So and another way of serving, there are many programs in harm reduction. A lot of the programs are boots on the ground. And I can tell you that I'm probably not going to be boots on the ground. I do not have experience in addiction or adverse substance use. And I'm sure I would offend. I'm sure I would stand out like a sore thumb. And especially if I'm in uniform, I'm not going to be boots on the ground. I'm not going to have the rapport that persons in recovery and lived experience will have. Even persons in active addiction will have. And so the reason I bring this up is a friend of mine was telling me how a priest had retired after like 30 years. And one of the questions, the priest was, hey, tell us what you learned. And the priest said, well, my first 5 years, I thought it was my job to stand on the banks of the river that was rushing downstream with a waterfall at the end, yelling at people, get out of the river, swim out, you're going to die. And then the priest said, well, it wasn't until my 10th to 15th year or 10th to 20th year that I really thought I learned it was my job to be down on the bank, on the edge, pulling people out as they come by, reaching and grabbing them, yanking them out of the river before they plummet to certain death. And he said it wasn't until his last 5 years of his service as a priest that he realized it was his job all along to be in the river, to be right there, arms outstretched, to pull people to safety, to catch them. Now, that's not for everyone, because it can be extremely dangerous. And some of you, that your comments that have at risk or you have lived experience, my judgment is you're better poised to be in the river. And equally, it's going to be more dangerous for you. But I just want to share that again is because some of you may be considering where's your place? What's your next step? I'm going to quickly go through this. Project Save Lives, you're going to hear about it shortly. I really got involved with this. And when I started speaking, city council, one of the questions of a city council member was, we need community involvement. So you hold a public forum, up shows Dr. Raymond Palm. Never met him before, but I remember when he first showed up and he talked about this project of putting people with lived experience in addiction at the ER, because he knew that I was the guy that was pissing them off with the Narcan, and they would get off that stretcher. As quickly as we lowered it, they're off the stretcher out the door. So he said, what if we can put people with lived experience, peer recovery specialist or recovery peer specialist, right there at the stretcher, right at the bedside to help develop the rapport, the language of love, and to help educate me, the nurses and the physicians. It has been a huge success. And the gold star standard is using people asking people to use their lived experience with substance use in this program. That is really the gold standard. And I'm going to skip through it. There's a lot of partners. We're at 7 hospitals now in Duval, 8 or 9 if you count Clay. Florida Blue is a huge supporter. A lot of the hospitals are. I'm going to skip through. And so just because looking at the time here, I'm going to skip through one video, but I want to, the video talks about that peer connection, which is key. And I thought I have another video here about what would stop you from considering putting a peer in your hospital or in your place, wherever if you're a receiving facility, even like a mental health facility. The total involvement so far of Project Save Lives is basically eligible for services. They've communicated, touched almost 8,000 people. Half are saying yes to services, which is great. So we've only lost 9. Of the people that have said yes and been peer services, only 9 overdose related deaths. That's a wonderful, wonderful success. I do all these monthly updates so that you may see, and I send them out to our city council. If anybody wants to be on that distribution list, let me know, and it's public record. So, and this a little bit about why should you consider such a program? Why should you consider using the very people with past addiction or even active addiction? How can we use them in a good way?
If you save one life, haven't you done something really great? I mean, really, that's the self-satisfaction of it. And we know that we've saved lives.
We have a relatively no-cost, successful model for you to implement which will reverse the emotional toll it's having on your staff. And not only that, reduce the number of times someone's coming in and shorten the time they're actually in the ED. And you're contributing to saving a lot of lives, because we've only had 2 overdose-related deaths since we started the project. Why wouldn't you?
I would say our mission as healthcare providers is to give every opportunity to save all people. And we now have everything at our disposal to make a difference in these people's lives and get them off of the drugs and keep them from repeat overdosing.
Tell me why not, and I'll tell you why you should. Is it a cost? I could tell you the exact cost for the program. I could tell you the millions of dollars that you're going to save by having a program like this. Is it because you have too much on your plate? I'll find you a grant where you can hire somebody. Tell me why not, and I'll tell you why you should.
Go through here. So I mentioned grant there at the end, and I was very fortunate that the Department of Health was able to provide through the HEROES grant, helping basically emergency responders grant. They provide Narcan, injectable Narcan, or any type of Narcan for police and fire and paramedics. So we originally got a $1.5 million grant to purchase that Narcan through SAMHSA. Well, after the Department of Health came in and said, "Hey, we're gonna provide you Narcan," now the question was, well, what do we do with $1.5 million? And I approached the city of Jacksonville and said, "Can we use it for nasal Narcan for the public?" And we looked into the laws. They said, "Okay, do it." And we hit a home run. We were able to hire Laura Villafor-Ray. There she is on the right. Some of you may know her. And to date, she with her partners, Drug Free Duval, and many other partners, primarily Gateway Community Services, have distributed almost 6,000 kits. And we've had 36 reported life saves with that Narcan so far. Here's one of our partners, Beaches Recovery. I'll create graphics like this and we put them out on Twitter or Facebook, the city's Facebook page. Our mayor's office is really on board about allowing us to use the PR media services to really spread this. So we do a lot of training. It's free, and it's in Duval County. And if you need it in your county and you don't know who the resource is, feel free to let me know. But I know DOH also knows who those resources are. But you should be able to get nasal Narcan free. I've been going this whole road of apathy to compassion and community. I've been spreading the word, going around and talking. I didn't realize it was an auto thing here, slides. So I've been doing a lot of speaking and going to everything from senior summits, talking about the dangers of even keeping pills and the dangers of substance use with elderly. So I've basically just been doing a tour. And as a result, the city council asked me to join their special committee on opioids. And that's chaired by Councilman Ron Salem. Just last month, we did we hosted a speaking engagement of the Health Council for the Jackson Chamber of Commerce. So I'm getting involved. I'm plugging in, again, asking, how can I use my privilege, my position, my posture, not as a bully pulpit, but as a pulpit to help educate and to help spread empathy and compassion and awareness. Harm reduction. I am becoming a harm reductionist. And these are some slides that I showed our city council in a very private meeting that we did not publicly disclose because I wanted to give our city council members an opportunity to be real, knowing that the media is not there. And I basically said, hey, if you've ever used Lyft or Uber, that's harm reduction. If you ever put on your seatbelt, that's harm reduction. If you thought about getting an HPV vaccine for your kids, that's harm reduction. If you're fist bumping, wearing a mask, all these things that we know are harm reduction. Putting on suntan lotion, the gun buyback, wearing a helmet. And I really had to make it, I would say overly simplify it to allow our city leaders to understand that harm reduction has been around. and when it comes to syringe exchange, almost 40 years when you look at Europe. So right now, myself and Laura are probably the biggest advocates pushing for a syringe exchange program here in Duval. It is going forward. Just a week and a half ago, we had a public meeting and legislation will be introduced in the next few weeks, which myself and Florida Harm Reduction Collective, a lot of the people in the harm reduction community that you know are helping. And if you're on this call, thank you. The Miami Idea Exchange, that really started this. They have been a huge supporter. So we have been working with our state attorney and our sheriff's office privately to really bring together understanding and support for a syringe exchange program to decrease, infectious diseases. So it's happening, and I hope you'll be watching Duval County to see that come to life. I'm going to skip through because I think I'm fixing to wrap up my time here. But one of the biggest things I'm learning is one of my nursing theories, the theory of human relatedness, that so many things are connected, and trying to understand somebody's connection to substances, or likewise their disconnection in relationship with other things that oftentimes at-risk substance use creates, and try to have an empathy for that. Just going to skip through. These are some pictures of syringes I found in my community. This is local, not too far from where I live. And all right, so something that when I worked as a nurse at an addiction treatment center, something that I would get patients that would come in 2, 3, 4 times over the course of, say, 6 months or a year. And when they came in, it saddened me because their face was dropped and they couldn't even look at me. And they're going, "Oh, I'm sorry, I'm back. I know you probably don't think I'm serious this time." Or they were beating themselves up. They were there because they were facing divorce or loss of job. And I say this, I tell them now, and I really believe this, that I'm in the job of giving people a second chance, even if it's for the 3rd, 4th, 10th time. And I hope that you would consider that for yourself. And if not, then, maybe it's time to step out or take a break to check yourself. I can only imagine, as I see on the outside, how people that struggle with substance use judge themselves or feel judged by their family. So the last thing I want to do is compound that or add to that. So I'll leave with this simple question, and feel free to please chime in. How many of you are either employers, your CEOs, execs, you hire or fire people, or you have a close relationship with the person that does hire or fire, or your HR person?
While we're waiting for some of those answers to come in, I'll let you know that you had an exactly exclamation point to support your discussion when you were talking about speaking with your elected officials. And also wanted to acknowledge that there is a person in attendance today with "I am here for vets." They are professional certified recovery peer specialist experts. And the email or the URL is IamHereForVets.org. Just wanted to let them know. Someone here says, "I'm a muckety muck tie wearer."
Okay.
And another person says, "I am." So they are one of the leaders you were asking about.
Thank you for outing yourself. The reason I ask is I had an opportunity several years ago to meet with Jacksonville Chamber of Commerce at one of their executive breakfasts. So at this table, this huge breakfast at the High-End Yacht Club in Jacksonville, were CEOs and executives of some of our largest employers, representing, they said at that time, at least 25% of the workforce in Jacksonville were sitting around a table that I was having breakfast with. So it was a huge honor. And I also knew it was an opportunity. So I took it. And this is what I said. I basically said, "Hey, some of you, like me, have thought that people with addiction, it's a moral problem. It's a problem of choice. It's a problem of their values. It's their moral problem." And what I said is that I would petition that what determines whether this is a moral problem is how you as employers respond to your employees who struggle. That's the moral issue here. How are employers providing, creating policies to support and encourage their workforce to come out from the dark, to get help, to be supported, not fear of being terminated or judged. And that's my want. And I would ask for y'all that out yourselves, thank you. And my want would be just to go back and look at your HR policies, look at your hiring practices. Do you create an environment that welcomes and encourages people, with either lived experience or even current to get help? And I know, the gentleman or the person here with I'm Here for Vets, that's a huge issue with veterans. A lot of employers are hesitant to hire veterans because of stigma. So I'll leave it there. And that's what I have. And I think we're out of time, but I would love to know if there's any questions, comments, or unmute yourself, whatever.
The only other comment I have in the chat is asking for your contact information.
Oh, yes.
I have another comment, very insightful. Stigma and discrimination begin in HR.
Wow.
Yes.
Okay. I didn't, thank you.
Yes. And we are closing up on our closing time. We will have information if you want to contact Helena Gerard. I'm sure you've seen her email throughout the program for today. She can give you contact information for our presenters. So if you don't find that here somewhere, oh, you have it right on the screen. Okay, Mark's contact information is right here, but also contact Helena if you need that information. We want to thank you so much, Mark, for presenting today and sharing your expertise. I appreciated your authenticity. Thank you. And for everyone attending this session, please use the link in your chat. Dr. Raymond Palm that Mark mentioned is our plenary speaker at 12:40. So if you would like to join that session and learn more about Project Save Lives, then look in your program and click the link. There's also an evaluation link in the chat box for you. We appreciate FSU, who's managing our evaluations. So please click on that link to evaluate this session, and you will also receive an email later to evaluate the overall summit. Thank you again, Mark, and we will close this session.
Thank you all.